All right. Well, thanks everyone for joining us for the webinar today. This webinar is called Lifeline Technical Assistance Webinar, Your Crisis Center and ACD Systems. So the webinar today is going to give you, it's basically an ACD Systems 101. It's going to give you an overview about using ACDs, their benefits, and their challenges. And we have two presenters who are going to be speaking with you. The first is Mike Dohack. Mike's been in this industry since 1989, initially specializing in rates and tariffs, and then migrated to an outsourced telecommunications department for business operations. And we actually first met Mike and started working with him when we transitioned our phone provider over to West, who we currently use. So he is just a wealth of knowledge in this area, has a lot of experience working with phone systems, and he'll be able to provide a really great overview. Our other presenter is going to be Shye Louis, who's our coordinator for best practices in suicide prevention. And Shye will speak to the bigger picture of how this relates to the Lifeline and some of the larger projects that we're working on. So you'll kind of see the whole piece come together. And just to reiterate, if you have any questions during the webinar, please feel free to write them in that chat box, and we will make sure we address each and every one of them by the end when we open it up for Q&A. So having said that, I'm going to turn it over to Mike now.
Okay. Welcome all. I'm going to go through this, and I like to have two-way dialogue, so if anybody has a question, by all means, from my side, I'd rather have the point cleared up if we can, but if it's better to wait till the end, we can do that as well. So today we're going to be talking about the ACD and Contact Center. They're two separate offerings, but we're moving into a world of multi-interface situations. So for today's presentation, we're going to be talking on first, how do we get here? Communications methods. We're going to talk in more detail about Contact Center versus ACD. We're going to talk about delivery options, and then we have a couple vendor profiles that we'll be covering as well. So how did we get here? I could spend 4 hours going through an entire history of things, but back in the day, and having started when I did, back in the day is pretty long ago, there was only a few vendors, then there was only a few equipment providers, and if you wanted something, you had to buy the hardware, had to get the network, you had to manage it, maintain it, and do it. It was a very expensive venture. Since those days, organizational needs with the advent of internet, with the advent of mobile devices and those kind of things, organizational needs have transitioned, and the industry as a whole has transitioned. And where it was before was everything on copper pairs going to business locations and organizations and homes, and now we're moving into a wireless world with fiber, and there's still copper and coax and all these other delivery mechanisms. And the drivers, the businesses and organizations like yours drive really what our industry does, which is telecom and mobility. And in the telecom and mobility world, we're always looking and listening to organizations. What do you need? What would make life better? And then every organization providing services is constantly looking at how do we do what they're looking for. So from here, I thought it would be important to kind of just go over the 5 different components or hardware options that are available. Legacy PBX and key systems is prior to voice over IP being invented. And in that scenario, you typically bought hardware, and for every station telephone set you needed to have a card that had a port available and it got hardwired to the stations. It was used for calling internally, so you can call one extension to another, as well as taking and receiving phone calls. Primary benefit of the PBX or key system back in the day was you didn't have to have a line for everybody. You could have, one line and share it between 5 people. We've evolved in the industry to IP call processing. That is using voice over internet protocol, and that allows a lot of different things, and we'll get into that a little bit farther. But once you get into the IP basis, you no longer have to manage and maintain 2 different wiring systems within your building, one for data and one for voice. It allows utilizing the internet to receive and place phone calls. It provides a lot of different benefits, and the industry's evolved to make these systems so much easier to manage than the other systems. Then the ACD, the call distribution, is designed to manage inbound calls and route them to the appropriate party, as well as giving the ability to really drill down on a per call basis, per agent basis, to make management decisions, to track and monitor, and to make sure that you're giving the kind of support that you have. For interactive voice response, it is designed to allow the person making the phone call to kind of direct where it goes. So sometimes it would be their telephone number, like on the suicide hotline, that determines where the call is routed to. Other times it's a voice response saying support or something, or DTMF, which is dual tone multi-frequency if you care, but that's the touch tones from a telephone set that would determine where a call would go. And then contact center is more of a fully integrated communications platform designed to integrate multiple medias like social media, instant messaging, texting, voice for sure, emails. It all gets kind of integrated into a single platform. And since Carol said it was like a 50,000-foot view, I want to make sure that everybody on this call knows that there are countless drill down and details underneath what we're talking about, but we're trying to just lay up a foundation to help bring some better insight into where things are. So in the old PBX days, you basically had a call processor, and then you had station wires to each one of the telephones. Somebody would call, it would hit the public switch telephone network, get to the PBX. It may go to the operator, but that's the typical configuration. And often, if you look at the picture down here to the right, this is what wiring closets look like, because people move and it was literally a hard wire having to change. You paid for the per port. Remote users weren't available at all. Then they were able to network 2 different systems together. It was very expensive. We would typically, when somebody said how much would it cost for a new system, we would tell them it would be about $1,000 per station. We've had it down as low as $500 per station and as high as $1,200 per station, depending on what they actually want. And these are budgetary numbers, so you could see the more stations you have, the more it would get expensive. One of the things about PBXs and key systems is the programming was written very cryptic. It wasn't very user-friendly, so therefore it always required a technician to do it. The later days, back in the late 90s, early 2000s, they were making simplified for basic functions, so the programming piece became easier. But a lot of times you had no choice but to contact the vendor and have them do it. Features are limited compared to today's. ACD was a bolt-on, so it was CRM integration. It was computer telephony integration is what they called it back for the PBXs. Reporting, you're pretty much limited to SMDR, station message detail recording, which was a call record of what station, what number was dialed, when did it start, when did it end, that kind of information, but it didn't give you any management reports unless you bought a separate system for that. And everything was proprietary. So if you bought an Avaya phone system, you had to buy Avaya phones. If you bought a ShoreTel, you had to buy ShoreTel phones. So this is what it used to be. And, you know, we've moved into this world of IP-based. In the IP-based world, in this diagram up here on the upper left is, you know, there's the public switch telephone network. And it would go to a PBX, and then you'd have your own separate telephone cabling to get to each one of the stations. When I went to voice over internet protocol, the voice now was IP packets, so therefore it can be carried over the data cabling. So you eliminated the need to have to wire all these stations wherever you want phone. As long as you have a data connection there, it'll also allows you to do more things because it's coming over your data network. Now your PC or laptop or tablet can be more of a tool to use when you're dealing with phone calls and those kind of things. It's a user-friendly system, so when it gets down to moves, adds, changes, somebody going to a different location, it no longer requires a specialist to do the majority of the programming changes. It's simply logging in, an administrator logging in and doing it. They all have desktop administration and call processing, so from your desktop you can see who it is. It can even integrate easier with screen pops to databases because it's all already in the protocol required to interface with the computer side. It also allows for remote users. Now there's multiple flavors of a remote user, but if you're an organization that has a distributed workforce and you have some people that are working from home, you can now, through IP-based systems, connect them to your phone system and they can appear as though they're in your building with brick and mortar. Integration is considerably easier now. Instead of using computer telephony interface where it takes this piece of information, converts it to that so that it can talk to this, now it's using APIs on the software packages, and the integration is much easier, much less expensive. And doing integration before could cost $10, $15, $20,000 just to integrate with a CRM database. A lot of these right now integrate with multiple platforms already, and I know iCarol, if that's something you're using, has an API that makes it extremely easy to integrate with that, so when a call comes in, you're in their platform at the same time you're managing the call. Features are more robust and pricing is flexible. Where it once was $1,000 a station on average, because of the ability to use soft phones as well as hard phones, as well as mobile phones, you're not buying as much station equipment, and based on the number of users, you pay for a license, but you don't have to pay for the hardware, a card that has 16 slots on it, so you got 16 stations. As you go, you have to buy more cards. The IP-based world that we live in is really making communications a lot more friendly for an organization to manage how they do and handle things. So the next piece is the ACD IVR. This, when it came out, is basically, it's a tool to help call centers, crisis centers that handle inbound and outbound phone calls, to give them information so that they can better manage workflow, customer relations, staffing, resources, those kind of things. You'll see in this picture here, you see a guy sitting here looking at his computer, and then you see the people in the background. There's two things that the ACDs and IVRs typically have. One is a management platform that allows them to look at and monitor the various people in the center so they can see real-time statistics. In addition to that, there's the ability to display on a screen the status of what's in queue, how long they've been waiting, those kind of things, so that everybody on the team can see where things are and can work accordingly. It does provide specialized routing. Administration now becomes more of a user-friendly platform because you're dealing specifically in the call center application with there. The call analytics, there's a lot, and we'll cover a little bit more of that, but the call analytics is everything. it's hard to staff when you don't know what you have, you don't know what your peak periods are, you don't have any comparison. It's hard to see where you are compared to before if you don't have any information. It's hard to even know and report to your funders what you've been doing if you don't have the call analytics. IP systems have gone a long way in providing, even on an IP-based system, if you're really not able to move up to an ACD system and a crisis center, the IP systems now have the ability to have an agent log in and log out to provide some ability to record phone calls and those kind of features. But an ACD as a bolt-on was typically a very expensive venture to get started, and then you have to do the administration on it. In today's world, all of these features are still there. It's just the way they're handled, the way they're priced, and the way they're delivered is different because of the IP platform. And then we're moving into this world where the people that are calling are not sitting at a desk, sitting at their house on their landline, calling a toll-free number. The number, or the way people communicate now is different than it was when I first got into the industry. When I first got into the industry, there was no such thing as a mobile phone. So yes, that makes me old. But now there's mobile phones, there's instant messaging, chatting, social media, and a holistic perspective on dealing with a contact center technology is also includes addressing the other ways that people communicate now rather than just purely being voice. So it's referred to as contact center throughout the industry, and you can see from this diagram that pretty much everything touches everything. So you've got the servers and that. You've got different applications, and you can see some of the features that are embedded into there, like recording, questions and answers, workflow. You also have the unified communications piece of it, which is where you can get into fax, video, texting, email, social media, collaboration. You can have outbound dialers. There's a lot of different things here. And then the integration piece goes into applications and database servers. So you can really develop, and you don't have to do it all at once, but you can develop a platform that allows you to start at one spot and expand to another segment or another media, and then go to another one and integrate some different things. So it's important that you get a platform that is IP-based at this stage. The industry and all call processing at this point is handled by the carriers at an IP level. So that's kind of where we're at. Here's a partial list of ACD call center features. Call recording, each state has their own rules associated with it, but a lot of times there will be a message this call can be recorded for quality purposes, which means that's their legal notice that the call is being recorded. It's pretty important when you need to reference something in an emergency situation. You've got the intelligent ACD for your call distribution. You can pretty much endless routing patterns. You can do it by time of day. You can do it by skill set. You can do it based on workload. You can do just an unlimited number of routing options. You can use an IVR. I refer to it as IVR auto attendant. We're all familiar with press 1 for sales, but IVR is also voice or the telephone number dialed or telephone number coming in. And again, these are just features that are there. Unified communications integration, which I just talked about. You can have virtual agents, so you don't need everybody in your building now. And so you can usually attract people that wouldn't be available through today's world. You can integrate them. Really, I'm not going to sit here and read all of these things to you, but you can see that there's a lot of features here designed to make the call experience better for you, better for staff, and better for the people making the phone calls. Because this is the suicide prevention lifeline people, what you do is critical, and you know, the better you can handle those people and the more comfortable they can feel, with a smooth, easy discussion. These features really go a long way. One of the things that is worth mentioning is this whisper messages. So if you're a supervisor, you can literally listen into some of the conversations. You can coach where the person that's handling the phone call can hear you, but the person that's calling in can't. You can do barging. You can do a lot of different things and handle calls depending on what's going on, all through your screen on your computer. ACD, as far as the data is concerned, there are so many reports, many of them canned, many of them you can make up as you go depending on the system. But at some of them that I wanted to highlight here is real-time statistics. This is what the guy on the computer on the previous screen would be looking at. He sees his agent statistics, calls, queue, agent status. Agent status is, are you logged in and available? Are you in wind up? Or, where are you at in that regard? But these are real-time statistics, and these real-time statistics can be placed in a, on a screen so that everybody in the call center can view it, or it can be just a supervisor. Historical reports and analytics, this is where you can look at what's happened and size up what you need for future staffing, give the various reports that might need to go to the various funding sources. You have the ability to drill down to such a minute little detail, because now you can make decisions based on real information versus making decisions based on what I think or I guess. This analytics makes the ACD bring a call center up to a level of professionalism, because you have the data that you need to be able to make better decisions. So when you go to contact center, the considerations are different because you need to be looking at more of what other integrations do you use, what methodologies, what statistics do you want to see, what kind of reporting do you want to see, what platforms are you wanting to integrate in with, and how are you going to handle those, what's your network, because the network to handle just voice is different than a network that handles voice, text, and social media. And so those are additional things that when we're helping an organization walk through this process, we are there to literally help vet out exactly what you need so that we can go after the appropriate source. For this, I'm going to pass this off to Shye. And yeah.
Okay, great. As Carol had mentioned, I'm Shye Louis. I'm the coordinator for best practices and suicide prevention for the Lifeline. And Mike gave me an opportunity to hop in here for just a couple of slides and try to tie back in why it might be worthwhile considering some of this technology that he's talking about to assist your center. We know from our network surveys that that there's only maybe 50% or maybe a little bit less, I can't remember the exact statistic off the top of my head, centers that have this type of technology already in place. And there are other centers who might still be considering it, and we want to sort of tie back into how that could be potentially helpful. You don't have to have an ACD or this type of advanced contact center technology to be part of the Lifeline network, but for centers that are interested and able to make this kind of investment, the access to the kind of data that Mike was just talking about, that having this ACD or some of these other technology pieces in place could really help you to increase your understanding of your capacity to handle calls. Some centers aren't always able to tell if they are meeting the demand of incoming calls because their number of incoming lines are busied out, that type of thing. You'll actually be able to have a better sense with technology like this of your capacity, your workload, and how it's distributed. What time are the calls coming in? What are typical times of days of the week? Where do you have spikes? Being able to take a look at where your workload is hitting and what kind of historic patterns you have is hugely helpful to understanding your staffing and scheduling needs. Like Mike was talking about, you don't have to guess anymore where you need people. You'll have a sense with this kind of technology where your staffing and scheduling needs might be that can really help you and position you to improve your resource utilization, including your resource utilization of your staff, and assigning them shifts that make the most sense for your center, and trying to figure out where you need to recruit more paid staff or volunteers to cover certain shifts, to figure out where you might need to downsize the number of staff or have them working in other projects to take advantage of different things. Having this kind of data access can be hugely helpful, especially if your center is thinking about how they can be competitive in seeking additional contracts or funding, which leads us to thinking about, and if someone would forward the slide for me. Anybody? There you go, fantastic. Which leads us to talking about the Lifeline's metrics project that we've been working on over the last 6 months or so, trying to pull together with folks. We realized that there is a huge change that's happened in recent years in the healthcare industry, which creates both an opportunity and a challenge for us as crisis centers. We're really all competing over the same or reduced resources in our communities with other organizations that are trying to provide similar services, trying to make sure that we are out there at the forefront and thought of first as a crisis service in our community. But frequently we also know that the expectations of funders are very unrealistic when they are telling you what kinds of standards they want you to meet, what kinds of key performance indicators or KPIs that they might be asking you to meet as you are looking at different types of business and bidding on different contracts. And they're really not applicable to Lifeline centers. We also know that there's no national standards right now that exist to which crisis centers are going to be able to reference when they're negotiating with potential funders about what's realistic or what are the special considerations for crisis centers. So we began this metrics project as a way to create a resource to establish some benchmark data, make some recommendations to educate both centers and funders so that they can inform their internal practices of how they're working with data and how they are working with the information that you can glean from this type of technology to both improve their services and to use it in negotiating with funding partners. So just a couple of lines on the next slide that I want to talk about in terms of the project and where it's going. We're working really hard, and we've worked with a group of industry experts to define some service quality and efficiency measures as they relate to our Lifeline crisis centers. We're going to be talking and providing some information and guidance in a paper to the network that talks about accessibility measures and other service measures. We'll talk about quality measures and the call handling process. We're going to talk about measures for efficiency, like contact handling measures and resource utilization measures that are going to help you to get some idea of what is most useful when taking these measurements and what other centers are doing around these metrics, target goals and that type of thing. So we're going to give you a lot of information about how other centers are doing it, what do we think the benchmarks are, what do we think the special considerations are for crisis centers. We're going to make some recommendations on those key performance indicators and get them out to you through this process where we've worked with our metrics work group. They're still following up with us, and they've helped us they've helped us put together a survey that was sent out in December, and we collected information through the beginning of January, and we're processing and analyzing that information now about what current centers in the Lifeline network are doing with some of these key performance indicators, some of these metrics that we are exploring and wanting to let you know more about. We've also looked at comparable industries, we are going to use that for these following deliverables, where we're going to have that completed survey that we share with folks, as well as that full report on network status, that benchmark data, and some of those basic recommendations that we want to get out to you. So while you may not use an ACD currently. So knowing and learning more about these metrics and how they're helping other centers to stay competitive, and how they're helping other centers who are using them may help us to gain some consistency as a network, and may help you think about whether or not this is an investment that you're able to make into some of these tools that Mike is talking about. So we wanted to tie that all together for you and have you be able to make use of Mike's information to inform decision-making in the future about how these metrics and how having access to all this rich data might be able to help you as you move forward with planning for your contact center in the future. So that's pretty much it, sort of laying out how it ties back to what the Lifeline's working on now. And then I know Mike has some more information for you going more in depth.
Mike, are you on mute?
Yes, and I had one heck of a conversation with myself. Thank you for saying that. All right. So the first part of this was just basically trying to lay a foundation of what was out there, what is out there, and where we're at right now is any organization that has a need to better handle phone calls, to better manage their staff, or to try to reduce their expenses can now look at the technology for communications as a means to accomplish that. When you go out into the marketplace, you're basically looking at 3 different platform options. One, cloud. Everything is cloud, 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 cloud. Cloud is different depending on who you talk to, but at the end of the day, it's a server that you access through the internet. And then there's a hybrid, which is a combination of cloud and on-premise, and then straight purchase the equipment. When we go into cloud-based solutions or hosted solutions, the pros of this one is that you're working on an operating budget versus a capital expense. There's really no maintenance or management associated with the hardware or the software because that's being done as part of the service that they're providing you. The deployment is easier than it's ever been for distributed workforce, whether you have people working from home or different offices, because this can integrate everything together. You're always on the latest version of the software. You've got minimal hardware expenses because you can even reduce the cost of the phone calls by utilizing phone devices, by using mobile, using your computer as your telephone. And the network requirements change from trying to have the appropriate number of circuits to handle the appropriate traffic with the appropriate people doing it. So you're not spending money on that like you used to have to do. When you look at cloud-based solutions, our homework shows that prices range anywhere from $20 per user per month up to $250 per user per month. With that kind of a spread, you can imagine that there's many, many, many details that make up one or the other. The cons, if you're one that likes to say it's mine, well, you really never own the call processing component of it. And when you get into cloud-based solutions where calls are coming in and going out through the internet, there are quality of service issues that need to be considered so that you have still toll quality voice. My phone just made a beep at me. Sorry about that. Cloud-based solutions, they're a great option for an organization that really doesn't want to be in the telephone business. They're looking for feature functionality, the ability to manage things better. It's very cost effective because when you can make it cost effective by what you're spending for network and maintenance and support and tech time, you can factor that all in. In a lot of cases, the net cost is minimal or even provides savings. So cloud-based solutions, and we're going to be talking with Nextiva a little bit farther down the road here. And when we talk to Nextiva, you'll see they're a cloud-based solution, and they're one of the best vendors out there for cloud solutions. The next piece of this would be a hybrid solution. Now, a hybrid solution has on-premise network and station hardware. So the calls still come into your location. You can hardwire or through the data network, you can still connect it. It gives you more internal controls and responsibility for that piece of it. It has on-premise desktop agents that directly interface with that, but it's cloud-based processing of the communication, whether that be SMS or voice or whatever. So the actual processing of the call is out in the cloud. The reporting capabilities, which monitors all of the activity, is out in the cloud. Integration with other applications is done out there. So if you connect with Salesforce or iCarol or whatever, that's done out in the cloud. So you're not trying to manage and maintain bandwidth to provide those functions. You have better backup and better redundancy and that goes true with all of the cloud applications out there. The pro would be less quality issues for the calls. Con would be it may increase initial costs, where in a total cloud scenario is 100% an operating expense on a monthly basis. When you get into a hybrid type solution, it either is a lease. If you want to do monthly payments on it, it would be like a lease or a rental plus the monthly recurring for the function that's done up in the cloud. And of course, you still have the on-premise where you purchase the equipment, you own it. It's one-time CapEx because it's capital expense, and it has shown to be easier to get a grant to buy a system sometimes than it is to get a monthly recurring commitment from somebody, from a funding source. The consistent platform, once you buy equipment, you use the equipment, you stay on the equipment. All right, so that is more of an operational, the consistent platform. There are cons. The system will become obsolete. This industry changes significantly every 13 hours is what the Gartner report said once. I think as it relates to the voice side of things, it's probably more like 120, but if you're talking about getting into the social media, the mobility, and those kind of things, it's probably like every 13 minutes instead of 13 hours. You manage and maintain the hardware and the software and all programs yourself, or you pay for it. New features will cost considerably more. It does require additional bandwidth and network services than for off-premise situations. Oh, you're echoing. Another thing about this on-premise in purchasing the system, it really makes it difficult to have a starting point that's affordable and expanding. If you're anything like the Mental Health Association of New York City, that organization over the past several years has grown so much. But if they had purchased a phone system or an ACD system or a contact center, that solution, with that growth, it would have been hard for them to be able to maintain it. If you go with a hybrid or a cloud-based solution, you can start one place and you can always expand and expand and expand based on different programs and projects that you get. Robert asked communication security lines when needing to find information for police. Right. In all of these worlds, everything integrates with the 911 platform and the various locations. Caller ID is identified whatever is set up in the system, so the communication security, it's still confidential, it still has encrypting, and it provides that. And there's a gentleman that I'm going to have jump on here in a few minutes from NetStevie. He might be able to address that more. But when you need to find info for the police, everything is still as if it's in your organization. You have actually more controls and better access to that information than you do right now because of the network level information. And Robert, if that's not good enough, by all means, let me know. So I think this, but doesn't it matter what carrier it comes in on? Yes and no. When you, and Robert, maybe it'd be better to have a two-way dialogue towards the end of this rather than the chatting. It's a very important topic, and we want to talk about that. Okay, contact info is in the back. All right, so we're in this world, and it's commonly referred to as this Internet of Things. And I put this slide up here because it just really speaks to what world we're in. You'll notice anything, anyone, any service, any path, any place, any time. That is the world we're coming in, and the millennials and the various people that adopt that, this is what they're looking for. And so if you're out there servicing the needs of an organization or a program or whatever, you kind of have to meet the people where they are. So where we start when we're looking at this is we sit down and we really talk through all of the details. You know, what do your agents need? What do the supervisors need? And there's like a 12-page form that we use that we walk through and ask a lot of questions, because what we're trying to do is define what it is that you're looking for, because you don't want to go out to 20 vendors and say, tell me what you think, because you'll never be able to compare apples to apples, and everybody's going to focus on their exclusiveness. From there, we look at defining what you want to do. You know, if all you want to do right now is do mobile and voice and maybe instant messaging, we can do that. But this determines, again, what goes into the request for the quote. From there, we say, okay, what do your people do? You know, if you look at the millennials, text messaging is huge, social media is huge, instant messaging, but email and phone are down here at the bottom, and that's the ones that are coming into this marketplace. And what we did is we looked up for social media platforms, and Facebook is obviously huge, and you can see the different social medias. So if you're looking for a solution that really helps you serve more people and be more impactful, this plays into what you consider doing. Social media alone has grown 975% over the past 5 years, and it's growing even faster now than it was the past 5 years. So this factors into what it is that you'd be looking for. So from there, our process, basically, just a quick overview, is we help define, you know, you define the needs, we define the components that are associated with it. There's a prepared brief request for quote. We have templates in our system that we could provide to anybody on this call or any organization around here, so that you can communicate effectively with the vendors what it is you want and how you want it delivered. We identify qualified vendors. We have a list of vendors that we vet out based on product, price, support, service, reliability. And you know, so if you're going through this process, to do these first 3 steps is relatively, you know, maybe 30 days to really get something that's true. Then we would sit down and go through every one of the components and say, okay, this is what it looks like, this is what you'd be doing here. So we have flow charts and everything so we can explain it, and it doesn't have to be us, but if you're going to be doing this process, once you've defined everything, it's very valuable to go back and kind of play out in your mind what they do, how they do it, well, what you want to see, what you don't want to see, what's important, you know, and look at it from a supervisory's perspective, a staff person, a person calling in, a person on social media, so that you know you can set reasonable expectations of what you're going to have at the end of the day. And then from there, our vetting process, which is what we did for the suicide hotline platform, is we received multiple bids. We always put it out to multiple companies, unless we just know, you know, what vendor is going to be the best and not have to go through that. But you receive the bids. We typically will break it down into 2 lead vendors. Either one of them would be good. And then from there, we negotiate with both of them and see which one gives us more of what we ask for. And we always ask for a little bit more when we're doing that round. You execute the paperwork. Once you execute the paperwork, then you'll have engineers come into the picture, and they're going to want to know exactly how you do something. So that the engineers will drill down. A lot of that, they'll give you best practices. But there will be decisions you'll need to make on how you want to do things and what you want to see, and you'll be providing information, maybe historical call information or whatever. Then the service or equipment will be installed, turned up, activated, and then they will do training. Once the training is complete, that's when you actually cut over to the new service. So I, with no feedback, it kind of leaves me in a hard spot. I don't know whether I'm making sense or not making sense. But there are 3 vendors that I wanted to pull into this operation or this discussion because they're good quality vendors. They really hit this marketplace well. West Communications, that is the platform that the Lifeline calls are routed through. Now they're providing an IVR response or an IVR platform. So the calls come in, it goes to the database, it looks at the area code, the prefix, and the zip code in some cases, and says, oh, that's this crisis center, and then it routes the call, dials to one of your locations, it rings into your phone system or ACD system or whatever. And so they're designed to be a very large vendor for very large call centers, and they've probably got 10 competitors out there. Each one has their strengths and each one has their weaknesses. And West is fabulous in that area. They do also have quite expensive ACD platform, and it's more designed for thousands of agents versus tens, 20s, and hundreds. So as far as the West drill down, if you're a large organization, we'd be happy to talk to you about it. We've got a whole library of information associated with them. The other 2 are ShoreTel, and that would be through CPI Telecom, and we'll have some slides on that, and Nextiva. Nextiva, based on our research, has been the premier provider of call center applications for cloud-based. They have an office platform that covers a lot of the things that we talked about for the call centers, and then they also have a call center application that takes that to the next level. I do have a gentleman named Mike on the phone with us or on this call, and Mike, if you would speak up.
Yeah, sure. Hi. Hope everyone's well. All right. And we've got a few slides here that we'll just kind of go over about unified communications and our call center package, and just pretty much everything that we have. Okay. So what we're seeing here is we're seeing the business features, that you may want or you need, from unlimited calling, auto attendance, receptionist dashboards, supervisor dashboards, agent dashboards, meet me conferencing, instant messaging and presence for your group, as well as fully integrated CRMs and APIs as well. Okay. Next slide, please. All right. So as far as the agents go, when we're talking about call center functionality, we're talking about ACD, we're talking about ACD states, disposition codes, being able to have those calls routed to a user, not really a device. Myself, I work up in the mountains in Arizona, at a place called Holly Lake, and it's about 9,000 feet, and I'm working remotely. Okay, so it doesn't matter where you're at. I have the call center that moves into my phone, and it doesn't matter where you're located. The desktop clients for fast-paced environments, we have the agent and supervisor dashboards, as well as some other dashboards that go along with the call center functionality as well. Dealing with average handle times, average speed of answer, estimated wait times, that type of information through a web-based application or desktop client, if you will. All right, next slide, Mike, please.
Yep.
All right. You can monitor these agents and the queues from anywhere. Doesn't matter. You can view the status of any agent or queue through the supervisor dashboard client. You can monitor that call regardless of that location. You can also set their ACD state. You can also move them into queues if necessary or need be. You can style monitor. You can also barge into calls as well. All right. And recording, retrieving, you can record any call, incoming or outgoing as well. Sorry about that. Somebody's calling me. I apologize. That's the life of a sales engineer. Always somebody's calling you. All right. Next slide, Mike, please.
Yes, sir.
All right. And this is a, a complete collaborative. UC Communications, we do everything from our call center functionality to our office plans to drive capability, for syncing and sharing, web collaboration to off-network and, of course, on-network individuals. Like I mentioned, the sharing and desktop control. Very easy. We have chat functionality that goes along with our pretty much anything from the office plan all the way to the call center functionality as well. We have that chat and that instant messaging for that. All right, next slide, Mike, please. All right, and moving into analytics and, of course, reporting. The analytics tool is quite amazing. You can generate specific reports just by clicking on, it doesn't matter, anything from your location to phone number to user. It can be broken down by area code if you need be, okay? You can have, this is a great tool, especially for staffing purposes, if you need to know exactly, when your high times are, which I heard Mike mention a little bit earlier. That's a great tool for that. The analytics is also a great tool for period over period, trend analysis, you name it, okay? Whereas call center functionality and call center reporting is going to be based off of queuing, your queues, your ACD states, your agent reports, outbound calling, inbound calls, all that information on a live basis. The analytics is also, it's more historic, but you can also refresh that, or it automatically refreshes about every 30 seconds, okay? All right, next slide, please. Some more analytics. Custom reports allow users to create reports tailored to the business needs, of course. We have over 250 report templates with infinite customization. You can create graphical and table displays. You can customize just about anything with the Nextiva Analytics. Mix and match users and call types from inbound calls to missed calls, from unique calls, and basically make it completely customized, okay? And, of course, you can also put these on a schedule. You can have them emailed out to you at any time, daily, weekly, monthly, and that can go to emails. You can also take the PDF or CSV file as well straight from the analytical tool. All right. Next slide, please, Mike. And some more on some of the analytics as well. We have in Nextiva in Scottsdale in the headquarters office, we have wall boards and dashboards kind of set up throughout the the building here. And we can see exactly what's going on. We can see who has, high talk time, who has high outbound dials. We can see what's going on within every single one of our queues, support, sales queues. We can see exactly what's happening, okay? Next slide, Mike. But those wall boards are amazing. You can see exactly what's happening at any time. You can have that just right on your computer. I pull it up pretty much about 2 or 3 times a day to see what's going on within our queues, okay? I mentioned the period over period analysis. Evaluate your employees, campaigns, initiatives for clear understanding of business effectiveness. Measure long-term and short-term growth. Understand the unibias performance of all business activities. Next slide, Mike.
Okay, so that's basically Nextiva, what I've asked Mike to talk about. One of the things that I want to point out is, everything that he's talked about is basically at the core of Nextiva's product offering, and the flexibility built into the reporting and the analytics and the screens gives you the ability that your funding source they can pretty much ask for anything associated with this, and from there you would be able to provide them the information, whether they want it daily, weekly, monthly, whether they want to see abandoned calls or how long your queue time was. Everything is in there, and it's not a database you need to maintain. It's done by Nextiva, and the systems are there, the resources are there, and it's extremely easy to operate. Again, there's a few of you that I know that the Nextiva product would be a perfect product for you.
And just to go off of that, Mike, I just also wanted to mention our Nextiva IVR, which is a fully, it is a real-time IVR, voice recognition where we can do queue for me callbacks, we can do email outbound campaigns, we can do surveys, we can also do outbound calling campaigns as well. So we do have a fully functional IVR along with the ACD.
And it's completely cloud-based, right?
Yep, correct.
So can you share with the callers that what they need to purchase? Do they need to buy phones? Is that included, or what? How does that work?
It really depends on which route you want to go, because you can use the application, the Nextiva application, which has a soft phone built into it, which you could then use a USB headset or whatever type of headset. For me, I just use the audio and the speaker on my laptop for the most part. But you can also go that route as well. You can go with a hardline phone that's connected directly into the internet connection. Just depends on preference.
Okay.
Mike, I wanted to just address real quick that we are getting close to the hour, and that if people need to jump off, would you mind really quickly just giving them your contact info if they have questions so that they can send you that?
Absolutely, no problem. It's back. Well, I'm going too fast for this system.
And then if people feel like they can stay on, we can go through these last couple slides. But I just wanted to make sure that everybody had the ability to get a hold of you if they needed to.
Understood. Yeah, and the ShoreTel offering, just a quickie. They basically play in the on-premise, the hybrid, or the cloud. The solution, when we talk about hybrid, it does provide you the ability to get these features without buying a whole lot of hardware and use the hardware you already have in some situations. So it's a complete different discussion as it relates to something like that, and I know that also plays into the Nextiva offering. So here's my contact information, and Don D is on here as well. We're here and available to do pretty much answer any questions. Just so you know, there is no fee to any crisis center associated with the National Suicide Lifeline. We perform all this service as part of our agreement with Mental Health Association of New York City, and we're here to help. We've got a passion to help not-for-profits, so our people in this world. So don't hesitate to call us. If you want to discuss anything, by all means, send us an email, give us a phone call. Robert, I see that you want me to send contact information. If you can note it down here, or it can be on the video later, and then we can talk from there. Thank you. It was right at 2 o'clock.
Awesome. Well, thank you very much, Mike. Thank you, Carol. Thanks, Shye. And if anybody has any questions, please let them know. But otherwise, have a good afternoon.
Thank you very much.
Hello?
Yeah.
Hello.
Hi, this is William Harms with the helpline. Did the call just end?
I think that was another conference call.
Oh, okay.
Yeah, because I thought, what did I miss?
Yeah,
Okay.
they're going, wait a minute.
Oh, okay.
Yeah, it was a call on the ACD.